Hi, and welcome to episode 22. There you go. I do know where we are, what day it is, etc., etc. I'm totally and utterly in control. They say as they try and find the notes. No, it's fine. It's all right. It's good. Last week I talked about I took us on a journey really through a timeline of the pathologization or the pathologizing of fat. Have I got something in my teeth? I have. How embarrassing. Suppose it doesn't matter unless you're watching me on YouTube. I think only 20 people watch me on YouTube, but that's fine. That's 20 people. I can't have something between my teeth for 20 people. Anyway, that was breakfast. It was delicious. Oh, I had I found this delicious coconut yogurt. It's like full fat coconut yogurt from Aldi. And I paired that with some granola and some walnuts and some fresh strawberries, and it was delicious. Anyway, moving on. Last week, I took us on a journey through the timeline of the pathologizing of fat. And this week, I really want to talk about how, or connect the dots really about, to our reality right now. It's all very well going on you know, doing a history lesson. And history is fun. And I love history. And I think we can learn a lot from history, but we need to be able to connect it to our reality, our here and now. And that's what I want to do today. So let's just do it. I mean, I don't know how else to introduce it really. We talked a lot to begin with about eugenics, right? And race science and all that jazz. And I really truly believe that the medical profession, unbeknownst probably to itself, because I think most medical professionals would be quite horrified when they hear me say this out loud, but I believe that the medical profession is still trying to create a superior race. Bear with me for a moment. Those of you who are like, oh, well, I can because I mean I've been privy to it, but beyond that, I just think if we take a moment to consider the way that the medical profession conducts itself, it becomes really quite obvious, and no more so than in the field of fertility. Um, it's really obvious, isn't it, that fat people are not allowed to reproduce. So says the health profession. So if you can have a baby, conceive a child on your own, then we can't stop you from continuing that pregnancy. Like that's illegal. So we allow you to have a baby, but we make it very difficult for you. And I don't know about you, but my experience of pregnancy and childbirth, because I had no problems with conception, was to be made fit to feel miserable the entire time. It was so stigmatizing and horrendous, and I was made to feel like my body was not capable of giving birth, that it was just going to be an absolute disaster for me, that I was putting my child at risk, and I was putting myself at risk, and I was putting everybody else at risk. And, I was such a high risk because I was fat. And actually, I was fine. I was absolutely fine. But I ended up needing uh, two emergency sections and then one planned section. And that was just because I made really, really big babies, and not just like fat babies or heavy babies, but babies with massive heads. My oldest middle child, his head circumference was actually on the 98th percentile, no, 99th percentile, I should say. So yeah, I mean, that was that. But I was made to feel because it was because I was fat. And I know a lot of you who have given birth will have similar stories. But if you can't get pregnant on your own, well, that's it. Tough. Like you just told you that's it. You're not allowed to. And I work quite closely alongside Nicola Salmon, who is fat positive fertility on Instagram. And I remember her once telling me that this clinic that was actually doing IVF in people, even with a BMI above 40, which is incredible. There was an incredible amount of pressure on this private clinic by the local kind of hospitals, because they were saying you're making more fat birthers, and we don't want that. We don't want fat people giving birth. That's not good enough. And they have lots of reasons, but their reasons are not that are not based in real science. And ultimately, I just think that if you want to breed a superior race, the way you do it, or the way that they did it back in the day, they believed in doing it, was like you basically don't allow certain people to procreate, and that's exactly what they're doing. They're just not allowing fat people to have babies. Um, and actually, sometimes it's really obvious. I don't know if you know this, but in the state of California, women's penitentiaries were allowing forced sterilization upon their inmates well into the 21st century. I don't know when it stopped. I don't know if it has stopped. I believe it has, but like I think it was happening up until 2010 or something like that. Forced sterilization. And if you know enough about your history and you go back in time, you'll realize that there were certain groups of people that were sterilized en masse. Indigenous people in the US, Black people historically have been people with a low IQ, people with developmental disabilities. There was all sorts of horrible names, which I will not name on this podcast, but that were used for people who had developmental delays. They were not allowed to procreate. People with mental health conditions. So there was all this ableism and racism and, white supremacy going on. And sorry, did I mention it's still going on? And did you know that Black Jews who are waiting to immigrate into Israel are being sterilized against their will, unbeknownst to them. They were being sterilized routinely. They'd go for a checkup at their gynecologists, and were given like contraceptives without them knowing. So this process is still going on, and like, did I mention it was Black Jews, like sub-Saharan African Jews, Ethiopian Jews mainly, I think some Sudanese Jews as well. Did I mention that? Convenient. It wasn't happening to any other Jews, just to the ones living in sub-Saharan Africa. You make of that what you will, but I'm just trying to point out that eugenics is not something that existed in the past. It's not a sort of a black mark in our history, a stain upon humanity that we have moved on from. Bullshit. Actually, it's very much alive and kicking in its own way. And also, it kind of like we've been building upon our kind of the field of eugenics has developed and has moved on, but the foundations are still very much the same. I just want to point out that like at the end of the day, the medical profession doesn't really care if fat people die. I mean, that's your experience, right? And there are so many examples I could give of that. And I'm not saying individuals don't care. I'm not saying that doctors don't care if their patients die. Of course they do, for the most part. But I'm saying that the profession as a whole doesn't really care if fat people die. It's not doing anything to prevent fat people from dying. If the profession cared about fat people dying, it would actually be doing something about weight stigma, knowing that weight stigma is an independent risk factor for poor health. So it'd be doing something about it, but it's not. So I mean, it's clear the medical profession as a whole doesn't care whether fat people die or fat people become unwell. But yeah, eugenics very much alive today. Then as we were going through our timeline, we started in eugenics, and then we talked about kind of the moral objections. I mentioned Dr. Lulu Hunt Peters. And she talks a lot about sin and punishment, and she was going on about how it was like it was our duty to feel the pangs of hunger, knowing that there's a child out there that's getting fed as a result of us going without, all this bullshit. So there's this whole kind of moral objection that people have with fat people. Like, society believes that fat people are greedy, that we are carnal, like we're also very lazy. We don't do anything, and let's be honest, there's also a level of thinking that we're very unintelligent, like we don't, we're slow. And there's nothing wrong with being unintelligent, don't get me wrong. Intelligence is not something that I particularly aspire to. I don't think people are superior in any way just because they've got a higher IQ. But I don't like the fact that people assume I have a low IQ just because I'm fat. I don't want anyone to make any assumptions on me based on me being fat, about me based on me being fat. You know what I mean? Anyway, and I think the medical profession absolutely has a moral objection to us as fat people. That's why doctors, individual doctors, and the profession as a whole always fixate on food and exercise. There are so many other risk factors, right? Like proven, like beyond even genetics. There's so many other things. So when a doctor wants to talk to you about your weight, let's just say that a doctor decides they want to talk to you about your weight. I don't think they should, but even when they do, they will always talk to you about diet and exercise and nothing else. Because why? Because we believe that it's literally that fat people have larger stomachs and are greedy and they can't stop eating. And also they're lazy, so they don't do any exercise. So that's the assumption, right? And that's a moral assumption. It's not based on any evidence. It's a moral assumption. Um, Whenever I hear anybody, any like I have been in all sorts of situations where people are talking about, oh, how could we improve the health of this particular community? And it will always come back to diet and exercise, and everything else sort of is kind of like still centers around diet and exercise. So, for example, we'll be talking about the environment. Living in a safe environment definitely better for a person's health, right? No question. But they'll make the environment, oh, yes, we need more green spaces. Why? So that people can exercise. Not because it's better for mental health, because it's better for social well-being, because environmentally there's less pollution when there's more green spaces and blah, blah. There's so many good reasons why green spaces are important. But everyone, the first thing that people think of, oh yes, green spaces, people can go out and exercise. Oh, they talk about food deserts. Food deserts are terrible. Oh gosh, food insecurity, terrible stuff. But it's done. The next thing is because people end up eating junk food and then they get fat. They don't talk about what it's like to fear not having food to feed yourself. One of the basic needs of every mammal, no, every living creature on this planet needs food. Plants need food, everything needs food, but food insecurity, it's nothing to do with like how that makes us feel and everything to do with but then they eat really bad food, they're what's it called, ultra processed food, bad for the health, they get fat. That's the underlying belief and like purpose for everybody is make people eat less and exercise more because fat is bad. And doctors just make these terrible assumptions about us. I don't know if you've ever heard like a doctor say, or like, don't you want to live a long time, see your grandchildren, or don't you want to be productive, don't be able to keep up with this or that, or do this and that, like, don't you want or the opposite, don't you want to not be a burden on people? You don't want to be a burden on anyone, do you? And they often will use these sorts of bold statements to kind of coerce, even blackmail people into losing weight. Oh, don't you want to live long enough to see your grandchildren? Well, then you need to have bariatric surgery. Oh, don't you want to, be able to go back to work? Well, then I suggest you start Ozempic. Um, and these ideas that we should want to live long, not live well, live long. This idea that we should be productive. Productive for who? For us? No. So we can make money for the man. Peak capitalism. Don't want to be a burden. Oh God, for fucking ableism. How fucking rude. Who says I don't want to be a burden? What if I do want to be a burden? What if I want to be a burden to you personally and individually? What if I like being a burden? Who says, like they say these things, but it's all very moral, isn't it? It's a very subjective thing. It's a very kind of, I believe that this is how you should want to be. You should want to live a long time. You should want to be productive and make money and pay taxes. That's what you should want to do. That's my belief. My moral objection to you, fat person, is that you're not as productive as you could be. And you are a burden to society. And you're not going to live long enough. And that's unacceptable. It's a moral thing, right? And also, I mean, let's face it, when people have moral objections, it's often because they want to feel better about themselves. Well, at least I'm not like this person. And I do believe that's still very much alive and well in the medical profession today. Look at me. I wrote so many notes, I have to turn over the page. Feeling good about myself today. Just woke up in a good mood. Ooh, moving on. Anti-fat bias. I think this is the obvious one. This is the one I talk about the most. I mean, there is studies, and I've talked about this over and over again. There are studies that show that the vast majority of doctors have both explicit and implicit anti-fat bias. So anti-fat bias that they are aware of, and anti-fat bias they didn't even know they had. And we, as fat people and fat patients, know this implicitly. It's our experience. It's the look of disgust. Sometimes it's just a micro expression, but it's enough that we as human beings can pick it up. It's the way we're treated. Doctors don't want to touch fat people. And again, we have evidence to support this, but we know it for ourselves, right? We look at the way that doctors examine us when they actually can be bothered to examine us, the way that they lay hands on us, the way that they touch us. And I say us, I say that as a fat person, but I am also a doctor who has always examined patients, and I am very conscious of my body language and my facial expression and wanting to reassure the patient that it's okay, you're safe, you're okay, you're safe in my hands. I know this is not nice. You're lying down. I'm putting my hands on your abdomen. And I'm pressing. Sometimes I'm pressing quite hard, and sometimes it hurts. And maybe I need to do more intimate examinations, which can be terrifying. And I try to make sure that my hands are warm and all of these things. I think I've talked about this before. Touching a person, and I don't giggle when I say that. This is a grown-up conversation right now, so don't be immature. But when I touch a person in the doctor's office, I want to make sure that that person feels comfortable. And most doctors don't care, especially if we're fat. And I remember being with a friend of mine once, and I'd gone with her to the doctor, and I thought that she might have appendicitis. That was the worry, that she might have appendicitis. And so he was examining her, and she kept apologizing for being fat. Oh, I'm really sorry. I know my tummy's in the way. And afterwards, I was like, why do you do that? Why do you apologize? And she was like, oh, I don't know. But I was like, well, I know why you did it. It was because he looked uncomfortable and you were trying to make him comfortable. This asshole gets paid a shit ton. It was the middle of the night. So he was working the night shift at like the out of hours center. I know how much money this man was getting paid to be there. I was like, this asshole is getting paid to put his hand on you, like to examine you, to check you don't have fucking appendicitis. So don't you apologize to him so that he can feel more comfortable. It's his job, and he is being paid handsomely for it. So this kind of feeling that we get, the way that like doctors don't do you sometimes feel that they don't want to treat us? They don't, like, say you're a bit short of breath, that they don't want to try out a new inhaler or do some respiratory function tests or do an x-ray. They want to blame it on our weight. It's a sort of compulsion almost. Maybe it's because it's easier. Maybe it's because they genuinely believe it, and they don't have the capacity to think outside of this kind of tunnel visioned, oh, well, it's weight loss first and everything else later. But sometimes I just get a feeling that they like it. Some doctors just like it. Let's be honest. They enjoy being the gatekeepers, being the ones who can control who gets treatment and who doesn't. And we go back to eugenics, and we go back to this current moral objection. I have the keys to I don't know. I lost that analogy. Sorry, but I have the prescription pad, right? Ultimately. So I get to decide whether you can try an inhaler or whether you're going to go away and lose weight in order to manage your new onset of shortness of breath. Yeah, that's my decision. And I think, they don't want to treat us doctors also, they like to blame us. It's easy sometimes to blame us, and sometimes it just fits with their own narrative. But all of this is anti-fat bias. It's looking at somebody, seeing them as a fat person or a thin person, and making decisions, clinical decisions, based on whether they're fat or they're thin. It's discrimination. But it happens. Like every day it happens. It happens. I know it happens. We all know it happens. We even have evidence to show that it happens. And as I said, if the medical profession cared, they'd do something about it. But they don't. So they don't care. Proof they don't care. There were a couple of other things that came up in the timeline, though, right? One was the money story. Remember, it was the Metropolitan Life Insurance Company who came up with the quote unquote ideal weight. It wasn't science. It was an insurance company. I mean, sure, they used quote unquote science to back up their kind of assertions, which were fat people didn't live as long. Not sure that was true, especially then, but fat people didn't live as long because being fat was a threat to life. Oh, and by the way, now we can charge you higher premiums. I'm not convinced. I don't know where, I don't, I want to see the calculations. I want to know how Lewis Dublin and the team came up with that number. How did they do it? I mean, I would be very curious. Not sure that it's out there. I've tried looking for it, I couldn't find it. The information, it's quite old now. about almost 100 years old. But I want to know where it came from because we have been using those calculations since then. Don't forget, it started off with the height weight tables, then the American dietary guideline, no, the dietary guidelines for American translated the tables into BMI. And then the WHO and then the NIH both decided to make these arbitrary cutoffs conveniently at 25, 30, and 40 convenient numbers. But that was all based on those height and weight tables. It all started from there. And since then, we've found that actually, when it comes to long life or better health, etc., it isn't people in the quote unquote normal weight brackets that are the healthiest by far. We know this now. We have studies to show it, but it hasn't changed anything, has it? We just kind of go, oh, we probably shouldn't use BMI. We'll still use it, but we probably shouldn't, because it's not very nice or when it's a bit racist. Yeah, do you think? So the insurance companies, they were making the money first. This is over 100 years ago now. They got to charge higher premiums to fat people, and they still do. I mean, I've met people who haven't been able to buy a house or haven't been able to do all sorts of things because an insurance company said you're too fat and we will not insure you, or your insurance premiums will be so high that you can't afford it. When we were just coming out of medical school, my husband and I, there was this company called Wesleyan, and they offer. I'm not quite sure what the way to describe it is for the vast majority of the population because it is purely for doctors and dentists. This company, they offer what they call locum insurance. So if you were to become sick and you had to take an extended period of time off, they would pay you your salary, and indefinitely. So they used to do this speech. They'd come in like we were, early 20s, young, healthy, fit. And they'd be like, oh, there was this one doctor, just graduated medical school, went skiing. Of course, they went skiing, went skiing, fell over and damaged his arm, was never able to use it again. And we've been paying him handsomely ever since for decades. Wouldn't you like that to be you? And I remember thinking, well, that sounds cool. Yeah, yes, please. I might even consider taking up skiing. And as I've gotten older, I seriously considered taking up skiing. But anyway, we both went down the route of trying to take out this insurance. My husband at the time, in very good health, very, very thin. I definitely had a quote unquote normal BMI. He got his, he went through the whole process. It's a long and involved process, and this was how much his premiums were. And then I got mine, and mine were almost double. And I asked them, why are mine double? And they said, because of your BMI. So I chose not to take it out. And so we decided, you know what, we'll just pay for his and hope I never get sick. And the irony is that, we've both not been able to work for a couple of years. And I really needed it at one point in time, like a couple of years ago, right? When I became unwell, I could have really done with that insurance, but I didn't have it because, I was too fat. And I'm not, don't feel sorry for me, folks. I mean, it's fine. This isn't me trying to tell you a sub story, but my point is that we literally, we are the same age. We were born in the same place. We both didn't have any interesting medical history at the time. We were very young. And the only difference was the BMI. And I'm female, born female. So I'm less likely to become unwell. Statistically speaking, in many ways, but especially in terms of my cardiovascular health, but that didn't matter. Anyway, that's me moaning, but like the life insurance is a thing, and many types of insurance. Certainly health insurance here in the UK, like if you're fat, it costs a fortune. Anyway, when there's money to be made, people come a flocking, right? It's chum in the water. The sharks sniff it from miles away and they come a swimming. And of course, the drug companies have been around for a long time, but never have they been as rich or as evil as they are at the moment, in my opinion. I don't think that there has ever been a company as dastardly as Novo Nordisk is when it comes to Wegovy and when it comes to weight loss drugs. There have been other drug companies who have done other very dastardly things, but when it comes to weight loss drugs, We've had many in the past, but they don't compare to the lack of ethics and morals that we see in Novo Nordisk when it comes to Ozempic and Wegovy. So the drug companies are massively impacting doctors. They're doing the training. There's a reason why your doctors want to prescribe you Ozempic, folks, especially if they're not getting kickbacks. I mean, some of them may be getting paid to prescribe weight loss, but most of them probably aren't. But they're still obsessed with it. Like they're obsessed. Some of you are just like say to me, like honestly, I can't. I walk through the door. That's all they can talk about. Ozempic. I went to talk to them about something completely different. Oh, it's Ozempic. Every condition under the sun that is remotely related to insulin resistance. Oh, you must take Ozempic. Oh, you've got PCOS, take Ozempic. There are studies that show that these drugs didn't really improve people's PCOS. Like they've actually done the study. Doesn't matter. Take Ozempic. Cool. So drug companies and just the weight loss industry as a whole, and you forget just how big people have this number 75 billion. Bullshit, it's way more than that. We're not just talking about weight management companies like Weight Watchers, etc., etc. And Weight Watchers is the big one, but there's loads. Right? There are thousands, hundreds of thousands of weight management companies, many of whom are working directly for your local hospital or your local authority or whatever it is, whoever's paying for your healthcare or whoever is sorting out your healthcare. They have contracts with these independent private weight management companies. So there's the money's in that, the money's in drugs, the money's in insurance, but it's also in food and quote unquote diet food. Do you know how much the diet food industry is worth? And we could go on and on. Clothing, this, that, and the other. There's when it comes to weight loss, almost everyone's able to capitalize on that now, right? And they sell you a lie. Fat is bad, thin is good, weight loss is amazing. Oh, and you need our product. So don't for 1 second forget that when people are telling you need to lose weight, chances are there's a financial reason for that, whether they're aware of it or not. They've been influenced by big business, big industrial complexes. Finally, we talked a little bit about the bad science, like the WHO with their kind of arbitrary cutoffs, 25, 30, and 40. Absolutely, of course, that happened. The world, science is just that simple. It's just that obvious. So this bad science, it's been around for a really long time. People have been opposing it for a really long time when it comes to weight science. I mean, Regan Chastain is, I'm sure you all know, you're all following her and subscribing to her Substack, I'm sure, and paying her for all the amazing work that she does. But like she spends every week showing us, proving to us how crap weight loss science is, just how much of an epic fail the entire it's not an industry, but the entire like thing is just terrible, terrible. But are we surprised? Think about the foundations. Go back in time. Eugenics. It started with eugenics. What we are we under the impression that it went, oh, eugenics, and then like, nope, changed our mind. Eugenics is terrible. Let's throw that out the window and start again. No, it was a continuation. All of this stuff. The Metropolitan Life Insurance Company created height weight tables, which we used until the 1980s. And then we turned them into BMI. And then the WHO took the BMI and turned it into these arbitrary cutoff points. It all started with an insurance company with a table that we don't understand, but we've never actually gone, do you know what? This whole thing is shit. Let's scrap it and start again. Even now, when they're saying we need to get rid of the BMI, we're not going to, but we should. Even now, when they're saying that, oh, by the way, just in case you were wondering, the only reason we're saying that now is so that Novo Nordisk can get their drug prescribed to people no matter their BMI. At the moment, you should only be allowed to take Ozempic if you're above a certain BMI, but they want anyone to be able to take it. And of course, you can get it privately, as many celebrities are anyway. But not just celebrities. But I lost my train of thought. Where was I? Novo Nordisk. I start moaning. See, this is what happens. I start talking about Novo Nordisk and it just blurs everything out. But yes, the bad science, but we never scrap it and think let's just completely change the way we think. No, well, if we don't want to use BMI, what should we use instead? Oh, let's use hip to waist ratio. How different is that to height and weight ratio? I mean, what is just hip to waist? I mean, come on. This is ridiculous. Oh, let's look at arm measurements, because what we've done is we've compared arm measurements to the BMI. Fuck's sake. Like, we're not smart enough to think outside the box. We are, you know, at the end of the day, the human race predominantly made up of sheep that follow, right? We don't go, oh, I wonder if we should just not do that at all and go in the complete opposite direction. Um, unless you're me, then you don't practice medicine anymore. Anyway, our foundations are rooted in some really shit science, and that continues today. The BMI was back in the day, it was all about white European men, right? That was it. Non-whites and women need not apply. And that is still the case for the vast majority of studies. There was a recent study that came out that showed that Wegovy, Ozempic Wegovy, was a life-changing drug for fat people when it comes to cardiovascular disease. But when you actually look at the study, it was a somewhat mid, as my daughter would say, it was mid drug for old white men, because that was it. They were all like, I think, I can't remember what the average age was, but they were older, they were white, and they were men. There was no one else in this study. So it's still a problem. Women are left out, females are left out of studies, non-whites left out of studies, other minorities absolutely left out of studies. You're often excluded if you're disabled. You can't be in a study because you have a disability. Oh, and don't get me started about me trying to find information about trans people. Forget it. It's not possible. And even like when I was trying to find information about trans people and PCOS, which is relevant, trans masks who are taking testosterone, how does it impact PCOS? I still couldn't find the evidence because they're not important. We're not important enough to be included in their studies. The studies almost always will have a BMI cutoff. So even when they're studying fat people, they're studying small fat people. They do not care about large fats, completely excluded from every study. It's bad fucking science. If you haven't done a study that includes people that look like me, then I cannot get any information. I cannot rely on the information. The evidence that you're showing me is biased because it doesn't include me or anyone that's like me. So how can I trust it? Bad science. And also, like, there's this obsession. And I remember once being on, I can't remember, it would have been on Twitter or maybe my first Instagram account. Maybe it was TikTok. And I'd said something controversial, like, oh, you know what? Fat losing weight doesn't necessarily improve your heart health. And yeah, people will just move it. Quote your sources. And once upon a time, I actually felt like I had to. Now I'm like, fuck off. But back then, I felt like I had to. So I listed some fantastic studies, and they all went, those aren't real studies. Why not? Because they're literature reviews. We want a meta-analysis. And I remember thinking at the time, really? So there is a level, as far as they're concerned, there is a sort of hierarchy, that's the word I'm looking for, of evidence. A hierarchy, and meta-analysis was right at the top. And you know why that really pisses me off? A meta-analysis is when we look at lots of different studies, right? Group all the data and then draw conclusions. A meta-analysis is only as good as the studies it's studying. That's the reality. There are plenty of meta-analysis out there, and when you actually look at the studies they've looked at, and you go, well, they're all shit. So congratulations on doing a shit study on a bunch of shit studies. And what's wrong with a literature review? Why is that bad? Like, I couldn't understand it. I was like, why is that worse? But here's what it is. It's white supremacy, folks. This idea that there are, this worship of the written word, and this idea that there is superior and inferior forms of data, lived experience is not relevant as far as these people, professionals, are concerned. They don't care. Who cares about lived experience? Who cares about it? I want the data, the statistics, the risk reduction. They want the relative risk reduction. They want and sometimes you'll look at a paper and you'll go, yeah, no, I hear you. There's a 20% relative risk reduction, but the actual risk reduction is 1.5%, as it was in the case of the cardiovascular study. 1.5%. What the fuck are you talking about? It's 1.5%. Nobody cares if their risk went from like 17 to 16.5. It doesn't matter. It's not real. But you know, they love these numbers. Oh, yeah. Love a meta-analysis and a relative risk reduction. And for those of you listening who don't know what those mean, you don't need to learn because it's all a lot of shit. We can take data and we could spin it to mean whatever we want it to mean. We can make it look fancy and good and amazing when in actual fact it has no real bearing on our reality. We've been able to do that. We have mastered the art of doing that, especially now, especially when the vast majority of research is funded by private companies, private organizations, drug companies, etc. Yeah, just, you know, who cares? Why do we have to live up to any standards? It's weight science after all. So bad science, money, greed, anti-fat bias, moral superiority, and eugenics and race science. That is impacting our lives every day. Fucking bad science, bad health. And it makes me want to tear my hair out. Because what has that got to do with health? And what has that got to do with medicine? What? Ooh. Your health isn't determined by your cardiovascular risk. I was watching The Daily Show. I don't know if you watched The Daily Show, and Jon Stewart was talking about the news. And he was saying how with 24-hour news nowadays, journalists spend the vast majority of their time trying to predict the future. What's going to happen when this happens? This is what the polls are showing. It's always about the future. No one is actually reporting on the present. Nobody gives a shit about what's actually happening because it doesn't make good news. I was really profoundly impacted by that in many ways. But it made me think about medicine. More and more, doctors do not actually give a shit about what's happening in the present. They care about predicting the future. Don't you want to live to see your grandchildren? Don't you want to be able to get back to work? Don't you want to reduce your risk of having a heart attack 10 years from now? Don't you want to prevent yourself from getting diabetes? Don't you want to prevent yourself from getting diabetes? Future. As if we can see into the future. We can't. Folks, even if we have a risk calculator, which we don't for the vast majority of conditions, but even when we have risk calculators, we know that those risk calculators are flawed. They're only as good as the data that we have, and the data that we have excludes a whole bunch of people. Case in point, we exclude Black people from most of the data, and then we make decisions about Black people's health using a risk calculator that is based on data that doesn't include them. And lo and behold, we find that it is far less accurate. Shocker for Black people. Shocking. It's less accurate. Who'd have thought it? Nobody gives a shit about the here and now. We're too busy predicting the future, a future which we cannot predict. And we've become so kind of like used to it that it's become like it's normal, and you expect it from us as well. When you hear us say, I'm going to predict something about the future, if you don't do this, this is going to happen, you just accept it because it's become normal part of our day-to-day discourse. But folks, doctors cannot predict the future ever. I think I've said this before on a podcast. When I did palliative care, I used to do a lot of palliative care. One of the things we were expected to do was to predict how much time our patients had left. You can't do it. It's not possible. You can hazard a guess and you're almost always wrong. Patients will surprise you. People will surprise you. There is no way to predict the future, but we're obsessed with it. And to the detriment of the here and now. We don't care about what's happening in your actual lives. Your well-being has become secondary to us being able to predict the future. Why? Because there's money to be made in predicting the future. That's the real issue. Take away everything else, there's money to be made or lost in predicting the future. So health has just become this word that sort of gives me the creeps almost. Like when I talk about health and healthy now, every time I say the word health, I'm like, ugh, because it means so many things. And and none of them are good. So I've been thinking about it a lot, and I've been trying to find the perfect kind of paradigm or framework to kind of explore health in a meaningful way. And I found some really good ones for kind of like population data and like, but not really for day-to-day practical, how do we as healthcare professionals talk about and think about health, like the framework that we use. I've just not been able to find a really good one. There are some, but they're all a bit shit. And then I thought to myself, well, you know what? If you can't find one, then you're going to have to make one of your own. So I kind of did. And it's an evolving framework. And I need to put that out there. It's an evolving framework because I don't think it will ever finish. It will never be complete. Um, but it's better than what exists right now. And I want to talk to you about that evolving framework. So I have created might as well call it a masterclass. Is that a masterclass? I don't know. I've recorded myself talking with slides. Talking about health, reimagining health. I think that's what I'm going to call it. I haven't decided yet. I haven't actually recorded it yet either. So I don't know when I'm going to release it. Hopefully it'll be in a week or so, but it'll be soon. It's ready. I just have to record it. But there will be slides and there will be pictures and there will be me trying to explain what I mean about when I talk about health. And I'm going to call it Reimagining Health. I just decided that in the moment. And it's free. And so anyone can watch it. And I really encourage you to, because sometimes I think that, well, no, I know that, not I think, I know that this world has completely and utterly destroyed that word. And rather than finding another word, I want to take that word back. I want to reclaim the word health, but I want it to mean something very different. So please join me somehow. It'll be all over my website, and I'll put a link in the show notes, and it'll be on my socials, and you just need to like download it and you can watch it anytime. And let me know what you think. I'll probably talk about it some more on this podcast. I'm just I'm so excited about the future. Okay, like the world is going to shit, but putting that aside, I'm excited about what the possibilities for people who choose to opt out of the current system and adopt an approach to health that is completely different to anything they've ever experienced before. And that doesn't mean that they can completely opt out because you still need the system to work for you, right? Like you still need to be able to access blood tests and x-rays and medications and blah, 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 blah. But I am excited for people to understand their own health, to understand their own bodies in a way that they've never been able to understand them before, because doctors have like prevented them from understanding just how awesome their bodies are. Really, I'm excited. I'm excited to be able to share that with people, and I have some really cool plans, and I'm very excited to share them with you. I've used the word excited one too many times, I think, but yeah, I'm going to be sharing them with you soon. But in the meantime, check out this masterclass that I haven't recorded yet, but hopefully we'll have by the time this comes out. And I'll see you next week. God knows what I'll be talking about, but I'm sure it'll be good. Maybe. Or hopefully. I don't know. Have a lovely week. See you then.